One Medical went public almost a year ago now. Being the CEO of a publicly traded company is somewhat different than being the CEO of a private company. How have you found that transition, Amir?
Overall, it's been great. I'm focused on the same things that I've always been focused on, which is, my true north is the member, the patient, the customer. How do we deliver for them? And how do we do it through this human-centered, member-centered, and technology-powered approach? So that, at some level, that's not that different. I don't really focus on the stock price, right? I'm not naive to these things. We obviously have, quarterly earnings and investors, and those are, really important. But we had private investors before this. They were really important. In nonprofits, we have boards and community stakeholders who are also really important. So I'm not sure from an overall leadership perspective that's that different. I mean, at some level, it's a different financing mechanism, right? Going to the public equity versus the private equity markets versus the private debt markets if you're a nonprofit or if you're in a for-profit health system, equity and debt. What is different, what I really do like, I do like engaging with the investors and analysts because they're smart. They have great questions. They're studying the market. They keep you on your toes, which is great. And so I think that part is super fun. But I'd say on a day-to-day basis and in the company, people are doing the same things. I'm not sure that changes that much kind of from an operations perspective.